Have you actually looked at your nails lately? Not to check your polish, not to see if they need trimming, but to see what your body might be trying to tell you, because your nails are a lot more than just part of your appearance. In many cases, they act like tiny warning screens for what's going on deep inside your body, and sometimes the signs they're showing aren't harmless at all. They can actually point to serious health problems that people brush off for months, sometimes even years. A weird color, a new line, a change in shape, brittle edges, white spots that just won't go away. Most people look at these things and think, it's probably nothing. But sometimes it is something. And if you know what to look for, your nails could help you catch a problem before it spirals into something much worse. So in this video, we're going through 7 dangerous nail signs you should never ignore. And make sure you stick around until the end, because sign number 7 is one of the most serious ones out there, and almost nobody catches it. 1. Pale or white nails. Let's kick things off with something a lot of people completely miss, because it doesn't look all that alarming at first. If your nails look unusually pale, washed out, or almost white instead of a healthy pink, your body may be trying to flag a deeper problem. Pale nails can be linked to anemia, meaning your body might not have enough healthy red blood cells to carry oxygen the way it should. And when that happens, your tissues, including your nail beds, can start losing color, but it doesn't stop there. Very pale nails can also be associated with liver disease, poor circulation, malnutrition, or chronic illness. If you've also been feeling wiped out, dizzy, short of breath, or just generally weak lately, this is not something you want to write off. Healthy nails should have a soft pinkish tone underneath. If yours look dull, white, or almost bloodless, your body may be waving a red flag right at your fingertips. 2. Yellow nails. Yellow nails get blamed on nail polish, getting older, or staining all the time. And honestly, sometimes that really is all it is. But if your nails are turning yellow without any obvious reason, especially if they're also getting thick, growing slower than usual, or becoming brittle, it might be more than just a cosmetic thing. Yellow nails are commonly tied to fungal infections, which can spread and get really hard to treat if you leave them alone too long. But in some cases, nails that stay yellow can also be connected to more serious conditions like diabetes, lung disease, lymphatic problems, or chronic inflammation somewhere in the body. There's even a condition called yellow nail syndrome, which can be tied to breathing problems and fluid buildup in the body. So if your nails are changing color and staying that way, don't just slap some polish over them and move on. Your body might be trying to tell you something a lot more important is going on underneath. 3. Blue or purple nails. This one is a big deal. If your nails or nail beds look bluish, grayish, or purple, it may mean your body isn't getting enough oxygen, and that's something you absolutely should not ignore. Now, blue nails can happen when you're really cold, and in that case, it's usually harmless. But if the color change keeps coming back, or it just doesn't go away, it could be pointing to a serious problem involving your lungs, your heart, or your blood circulation conditions like asthma, COPD, heart disease, or poor oxygen delivery can sometimes show up in the nails before people even realize how serious things are getting. If you're also dealing with chest discomfort, shortness of breath, fatigue, or feeling lightheaded on top of this, don't sit on it. Your nails shouldn't be blue. If they are, your body may genuinely be struggling to get the oxygen it needs. 4. Spoon-shaped nails. Let's talk about nail shape for a second. If your nails start curving inward like a little spoon, where the middle dips down and could almost hold a drop of water, that's not normal. This is called koilonychia, or spoon nails, and one of the most common causes is iron deficiency anemia. That means your body might not be getting or absorbing enough iron, which directly affects how your body transports oxygen and produces energy. But spoon nails can also show up with thyroid problems, nutritional deficiencies, heart disease, or other chronic conditions. A lot of people walk around with low iron for a long time without ever figuring it out. They just assume they're always tired because of life. But your nails may be telling the truth long before your energy completely bottoms out. If your nails are changing shape, your body is asking for some attention. 5. Dark lines under the nail. This one is among the most serious signs on this entire list. If you notice a dark brown or black line running vertically under your nail, especially if it showed up out of nowhere and you haven't injured that finger, do not ignore it. Sometimes it really is just from a bruise or an old injury. That happens. But in some cases, a dark streak under the nail can be a sign of subungual melanoma, a rare but very dangerous form of skin cancer that develops underneath the nail. And because people so often mistake mistake it for a harmless mark, it can go completely unchecked for way too long. Pay close attention if the line is getting wider over time, the color looks uneven, it's showing up on just one nail, or the pigment is starting to spread into the skin around the nail. That's not something to casually keep an eye on for a few months. That's something to get checked out by a doctor. Sometimes a deadly disease doesn't start with pain, sometimes it starts with a line. 6. Clubbed fingernails. This one can be really subtle at first, which is exactly what makes it so easy to miss. If your fingertips are starting to look enlarged or swollen, and your nails are beginning to curve downward over the tips of your fingers, that may be a sign of what's called clubbing. Clubbing doesn't happen overnight, it develops slowly, which is why so many people never even notice it until it gets pretty obvious. But this change in your nails can sometimes be connected to serious long-term conditions involving lung disease, heart disease, inflammatory bowel disease, or even certain types of cancer. Why does it happen? Usually because the body has been dealing with low oxygen levels or chronic inflammation over a long period of time. A lot of people chalk it up to their fingers just changing as they get older. But if your nails are getting rounder and more curved, and your fingertips look puffier than they used to, it's worth paying attention to. Because clubbing isn't just a cosmetic change, it can be a clue that something much deeper is going on. 7. Horizontal lines or deep ridges. This last one might be the most overlooked warning sign of all. If you notice deep horizontal grooves or lines running across your nails, these are called Bow's lines. And they can show up after your body has been through some kind of major internal stress. That could include a serious infection, a high fever, uncontrolled diabetes, kidney disease, heart problems, or extreme physical stress on the body. These lines form when nail growth temporarily slows down or stops completely, because your body is too overwhelmed dealing with something bigger going on inside. In other words, your nails may actually be showing you a timeline of a health crisis your body went through, even one you didn't fully realize at the time. And if these grooves keep showing up or they're appearing across multiple nails, it may mean your system is under a lot more strain than you think. This is especially worth paying attention to if you've been feeling off lately and just can't put your finger on why. Your nails don't just grow, sometimes they keep a record of what your body has been through. Your nails might seem like a small thing, but the signs they can show you, those can be huge. Pale nails, yellow nails, blue nail beds, spoon-shaped curves, dark streaks, clubbing, deep ridges across the surface. These aren't things to panic about the second you notice them, but they're also not things to casually brush aside, because your body almost always whispers before it screams. And sometimes those whispers show up in the last place you'd ever think to look, your fingertips. So the next time you glance at your nails, don't just ask, do they look okay? Ask, what are they actually trying to tell me? If even one of these signs looks familiar, especially if it's new, it's been sticking around, or it's showing up alongside other symptoms, it's worth having a real conversation with your doctor and getting it checked out. And if this was helpful, stick around, because your body leaves warning signs in a lot of other places too. Your skin, your eyes, your feet, even your tongue. You just have to know where to look.